Hi friends, this is Dr. Ravi Kamepalli. I'm an infectious disease, wound care, and obesity medicine certified physician in Georgia. My website is nobadbugs.com. My X handle is @woundphysician, and hashtag that I commonly use is removing barriers to healing. My conflicts of interest are nothing but removing barriers to healing for infections, wounds, and obesity. I'm working on a telemedicine platform that helps towards that. So here we're going to talk about poster presentation for patients who have approach to wound healing in diabetic patients in a real world scenario using platform-based tracking that empowers patients with high touch techniques. Basically, we went through patients who have chronic wounds in our practice. The problem with wounds is that they are chronic, and mostly in patients with diabetic patients have low carb approaches that are not used. But what we have seen is that this approach helps with our patients. So we decided to have a retrospective chart review of patients. 29 of them were done with patients' BMI, weight, and waist circumference tract, and findings of this integrating therapeutic carbohydrate restriction was done with enhanced wound healing standard of care. And this was most of the people with diabetes and also wound healing have metabolically compromised status. So what happens is in chronic wounds, they are a significant problem in healthcare. And mostly the patient's problems include glucotoxicity. Traditional approaches involve frequently giving nutritional supplements, but there is glycemic load on them, and that causes metabolic health issues. So we have given that therapeutic carbohydrate restriction is shown some improvements in other areas, improving insulin sensitivity by low carb, high protein approach was thought to be a good idea. So we got together a program where we counseled all our patients in a manner in which the glucotoxicity is improved. And we then went on to collect the list of people, but it's a real world review of patients. And this is a retrospective review whereby we went through the implementation process, which was standardized for all the patients. And our clinical review involved improving metabolic health and counseling in low carb, high protein diet. And we reviewed 29 patients. These were all provided the same guidance. Of that 29 patients, we found 11 were diabetic, 7 were post-surgical, 4 were venous ulcers, 4 were arterial ulcers, and 2 had traumatic ulcers. It's hard to review and compare one etiology to another, but the maximal etiology that we had was diabetic, and also diabetic wounds have a certain process of studies that were done that show that within 12 weeks, if the wound heal, then that is the best criteria for healing for diabetic wounds. And that too, this was a study done by Dr. Sheehan et al. And in that study, it said that anybody who's healing by 50% by 4 weeks, they should go on to heal by 12 weeks. So the initial step was identifying the type of ulcers and following their metabolic health status. And we took data from that and de-identified for analysis and categorized by etiology, and we came up with these graphs. So the results showed that average healing time with therapeutic carbohydrate restriction experienced a reduction in time to heal, and also there was reductions in BMI, waist circumference, and the high levels of nutritional components were strongly associated with faster healing. So if you see here in the nutritional compliance to weeks of healing, in a fully compliant patient, The patients who are fully compliant healed within less than 9 to 10 week area, around 10 week area. Partially compliant patients healed around 13 weeks, and non-compliant patient took a longer time. And also nutritional compliance versus waist circumference. So if you see patients who were compliant, the waist circumference went down, and obviously partially compliant did not do that, and non-compliant really did not do that too. So the issue is a percent, when we looked at the percent change in weight versus weeks to heal. In weeks to heal, if you see people who had better healing had the percentage of weight was better with the people who had better weight improvement had better healing. Also, the other major thing that we notice is in patients with nutritional compliance, the medication reduction in people who are fully compliant, the medication reduction was good when compared to partial or non-compliant. So basically, the impact, what we are trying to show is that this study is showing a diverse population with multiple comorbidities, and metabolic health plays a significant role with improvement in BMI, weight, and waist circumference. And also, nutritional compliance is a key factor in this aspect of healing, and this is something that has to be paid more attention. So basically, this study suggests that low carbohydrate, high protein nutritional approach can enhance wound healing with higher nutritional compliance linked to faster healing. And this is a real world setting, and further stratified and follow-up studies will be planned. And patients get blamed a lot for not reporting data, but trying to create a platform-based solution with high touch that we tried in a real-world scenario did show significant outcomes. And overall studies suggest that metabolic health approach to wound healing is valuable addition to standard of care, and particularly in managing chronic wounds and people associated with metabolic dysfunction. Please feel free to look at the presentation, the links for which are widely available in social media. The scans are on the bottom, and here you'll have a video playlist of a few patients that we have recorded, and there will be all the patients. I will try to record them, upload to the video list later also. And please scan and read this one for effective showing evidence that 10% of weight loss can improve healing. Please follow us at our social media, and the hashtag that we use is removingbarrierstohealing. Thank you for taking time and listening, and feel free to reach out if you have any questions. Thank you very much. Take care.